This is going to be everything you wanted to know about non-surgical cosmetic treatments in English by a layperson. But I've been around it for 17 years, studying it, researching it literally every day. So you couldn't get a better source of it. And plus I answer the phones at Precision Aesthetics. So I've spoken to, let's see, 3 people a day for 17 years. That's about 17,000 people, literally. And they tell me every single treatment they've done, what they liked and what they didn't like. So unless you want to spend $1 million on a survey of 17,000 people, this is about as good as it's going to get, literally. Anyway, so in the beginning there was lasers. We all know what that is. You saw the James Bond movies, cutting steel. And you all know you can get rid of little red spots, whatever, tiny veins, not big veins, just very little thin veins. No more than that. Actually, one of my friends does vein stripping. Anything bigger than a tiny vein will grow back, so it's not the best way to get rid of veins. But anyway, then in 2001 came a very interesting innovation. Thermage came out with radio frequency for skin tightening. They got the patent for that back in 2001. So the doctor hates when I speak this way, but we normal people need a frame of reference. So as you know, when you put your chicken in the microwave, this heat goes to the middle and doesn't get the skin brown. Well, that's actually a beautiful thing when it comes to skin tightening. If you tried to get rid of a wrinkle on your face with a laser, you would burn your skin long before you ever got to the collagen layer to get rid of that wrinkle. So what Thermage did with calibrating the radio frequency to go to the collagen layer without burning the skin is they allowed us to stimulate the collagen, tighten the collagen for an immediate tightening and elimination of some wrinkles, and then more growth of collagen over the next 3 to 6 months, which is just beautiful. And as you can see with my beautiful face, I've done that a number of times over the past actually 17 years. And it's like magic. See, firm skin. I'm trying hard to get it to do something, but it doesn't. So Thermage is like magic. So then came BTL with Exilis. We actually met them in Europe in 2009. We got the president of BTL, and he said, oh, so my biggest competitor is Thermage. And I said, well, as we stand here in Monte Carlo, Google search Thermage New York. And at that time, black hat, but hey, we had 3 spots on page 1 of Google. So we got the first BTL device in New York, the Exilis, for skin tightening, but it was actually calibrated to also, they had another handpiece that went to the fat layer for body shaping. So that's just freaking beyond genius, to melt fat with one handpiece or just tighten skin with the other handpiece. But it doesn't go the exact same depth as Thermage. Sorry, this is in the weeds, but this is for those who want to get into the weeds. So Thermage is the best one-time non-surgical skin tightening. You can do your face, you can do your arms, you can do the front of the thighs, back of the thighs, stomach, you know, whatever you want to do, Thermage skin tightening. And then we use Exilis. We prefer to use the fat handpiece. It actually has ultrasound and radio frequency, so it melts the fat and tightens the skin. And ironically, the exact opposite of cool sculpting. Cool sculpting is a joke. I'm sorry, sue me. But you freeze the fat, and when it works, which is rarely, I've spoken to a lot of people, rarely works. Most of them said they got no results at all. But when it does work, you get more loose skin. Like, are you freaking kidding me? So now you're gonna spend $5 grand or more to tighten the skin, and from a condition that Cool Sculpting created. Now that's if you're lucky. If you're very unlucky, 1 out of 100, whatever the number happens to be, you get paradoxical hyperplasia. Look it up, paradoxical hyperplasia. That's what Linda Evangelista complained about and sued him for $50 million. What happens is a paradox. The exact opposite happens. So instead of getting rid of fat, the fat cells multiply like crazy, get hard as a rock. You have to wait a year to get it removed by surgery. Like, that's insane. I actually made a website. I called it fatfreezing.info, and I made another one called coolsculpting.nyc. Back in 2016, I was so angry that people were doing this, yet if I was doing it, I wouldn't be doing this video because I'd be retired 10 years ago. People are making millions of dollars a year doing cool sculpting because they had a $100 million a year advertising budget, not because it was a good procedure. It was a horrific procedure. Like I said, it created horrible side effects and no effect for many people as well. I remember speaking to one lady, and she said, you know, I always ask what you've done, And I said, okay, well, at least you didn't do cool sculpting. She goes, I did. I said, well, so you didn't get paradoxical hyperplasia? She goes, I did. She goes, it was more painful than childbirth. I had to wait a year to get the fat removed. Anyway, disgusting. Sorry for this. Well, it's not an aside. It's important for you to know. It's a shitty procedure, okay? It deserves a curse word. And they should be ashamed of themselves, including the doctors who do the procedure, because day one, we were aware of those horrific side effects. And I even took a screenshot of the Cool Sculpting website, which said paradoxical hyperplasia. And actually, when you look up hyperplasia in the dictionary, it says, oh, the rapid multiplication of cells usually preceding cancer. I'm like, okay, it's not that it causes cancer, but it was the definition of it. Okay, so now, then along comes BTL back into the United States in, I guess, 2018 with Emsculpt. Now, Emsculpt stimulates your muscles. So, but it's a really ridiculous 20,000 contractions of your abs, which of course you don't have the glycogen necessary to do that, so your body breaks down some fat. So the original device was 20,000 contractions. It was I think it was plus 16% muscle, minus 19% fat. So after we buy that machine for $250,000, then a year later, they add radio frequency to it, which, increases the results a couple of percentage points for whatever. But anyway, and then fast forward to 2022, fall 2022, and face, so we can do the muscles on the face. So now we can do the muscles on the face, increase the muscle by 37%, and lift it 30%, and we do the forehead, we do the way they set it up, and we're going to probably modify it a little bit. Actually, we immediately went to 6 treatments because 4 treatments is silly. Why not get 50% better results? So we can do M-Face to do the muscles and the skin tightening. We can do Thermage to do a more dramatic one-time skin tightening. We combine both. I'm sorry, I'm talking about us. I'm trying to be more general, sorry, but these are the things that are available out there. We did pass on Ulthera. You can Google search Ulthera and lawsuits. We love the Exilis, which has radio frequency and ultrasound on the body, but on the face, there's too many nerves close to the surface of the skin. You can Google search yourself and decide whether you think it's worth it or not. It's extremely painful, and some people claim they had nerve damage. Okay, so let's just leave it at that. I'm not going to diss Ulthera as much as I do Cool Sculpting. And that's probably pretty much it. So you can tighten your skin, you can stimulate your muscles, do your face, your body. And then we do carboxytherapy for stretch marks. A lot of you are familiar with microneedling. That's when you make micro punctures so that the skin can repair itself more perfectly. Actually, they even do it the doctor does it with a 1.5 millimeters. The home use is only 0.2 millimeters, like a little, it looks like a meat tenderizer. It's a little roller. Be very careful with it because number one, if it's not absolutely sanitary, you're going right past the skin barrier and you'll get a horrible infection. Number two, the skin cream you've used your whole life that swears it penetrates the dermis. Well, guess what? It didn't, because now that you're using that cream that you've used every day for 20 years with a micro needling, it's definitely going past the surface, and you could get irritated by the cream you've always used. So be careful with that as well. So anyway, I'm sorry, I was trying to talk about carboxytherapy. So carboxytherapy is, to me, it's like microneedling on steroids, because you're using the needle that's literally used for taking blood, and you're breaking up a stretch mark, and you're putting in a drop of CO2 gas. So not only have you broken up the stretch mark, but you're forcing the body to increase the circulation to that area, because as you know, every cell in your body is trying to get rid of CO2 and bring in oxygen. So you're forcing the body to increase the circulation, which of course is healing. So you've broken up the stretch mark with a needle, and you've now increased the circulation. So carboxytherapy is magic for stretch marks. I mean, I remember answering the phone, the girl's flying in from Denver just to do carboxytherapy with us. And I said, oh, it's 12 treatments. I said, so you're visiting friends this weekend? She said, no, I'm coming just to see you guys. So there you go. How magical is that? And Dr. Lisa did the original United States research on carboxytherapy. Literally, there is no one better than that. And of course, she taught Danielle how to do it, and Danielle's become phenomenal on her own and developed her own techniques to the next level with her experience. And it's funny, I talked to Danielle and I said, you've probably done, I don't know, 15,000 treatments. What, even if it was 20 a week times 50 weeks, 1,000 a year times 50, she's done at least 20,000 treatments. So yeah, she kind of has a little bit of experience too. That I think rounds it out. So we have Exilis for body shaping, we have Thermage for one-time skin tightening, we have Emface, which we recommend 6 times on the face. You have Carboxytherapy for stretching. Oh my God, how could I forget? Emtone for cellulite. So this is actually a fabulous story. So as I mentioned, we brought the first Exilis device to the United States in 2009. Well, Jan Zarsky, the president of BTL in 2009, gives us a call in 2010 and says, hey, I know you guys do a lot of body shaping. He goes, and a lot of body treatments. He goes, our company is mostly physical therapy. We have this physical therapy device called acoustic wave, which we use to help them, physical therapy, muscle recovery. The women are swearing their cellulite's disappearing. Will you take the machine for me and do a study? So we take the machine, the acoustic wave machine, and Danielle calls me up and says, you're not going to believe it. We were previously or currently doing Thermage with the CL cellulite tip, charging $5,000 for one treatment. She said, but the acoustic wave is so much more effective. The women are going crazy. I said, now to get into the weeds a little bit, what's happening is the acoustic wave is hitting the muscle fibers and stimulating them to heal more quickly. That's the physical therapy reason for the machine. What cellulite is when the mesh that should be holding back the fat gets loose, from age, hormones, whatever, and now the fat starts poking through. That's the cottage cheese effect and look of cellulite. So it's that same acoustic wave is hitting that fiber band that should, or the collagen band that should be holding back the fat and tightening it back up, and so therefore getting rid of the cellulite or reducing the appearance of it. We can't use certain words to be more precise. It's illegal to say cure or any of that stuff. Even laser hair removal, you're not allowed to say it's permanent. But anyway, sorry for the aside. But so it's magical. And even back then, I said, Danielle, great. So what are we going to do with this acoustic wave? She said, well, 10 treatments. I said, 10 treatments instead of 1? Are you kidding me? That sounds like 10 times more work. I said, what are we going to charge? She said, like $1,800. I'm like, 10 times more work for 80% less money? She goes, but John, the women are so happy. The treatment is fabulous. So just to give you a little aside as to who we are and how much integrity we have. But fast forward 2020, BTL sees the potential in this machine, so they add radio frequency to the acoustic wave, and they rebrand it and call it Emtone, and that's for cellulite, FDA approved for, or FDA, yes, I get confused, approved or sort of whatever. But anyway, so that was released at the end of 2019. We were the first in New York to get it due to all our research and contribution to the acoustic wave for cellulite. We were allowed to be the only place to call ourselves the doctor's training facility for Emtone in New York. And then, of course, the pandemic hit. But anyway, Emtone is fabulous for cellulite. And sadly, since it launched right before the pandemic, they never really put much into that, the marketing of that. I guess they're happy with their Emsculpt and Emsculpt Nia. That's kind of cool for celebrity BS. They haven't put much marketing into the Emface either, and they haven't put much marketing into the Emtone either. But it doesn't matter. If you want to get, if you want your face lifted, I mean, by the way, think about that. So you go for a facelift, you give someone 20 to 60,000. I hear it's up to 200,000 now. So you're taking the same amount of skin and the same amount of collagen, just stretching loose skin over your face. Now, okay, you could be very skilled at that, but wouldn't making more muscles, restoring your muscle and lifting everything be a more, first of all, that's what a facelift is, lifting and using your own muscles to lift your own face. I mean, that's just beyond magical. That's a real facelift. It's non-surgical, and it's at 20% the cost of a real facelift. And matter of fact, when we were back on the east side in Dr. Romo's office, he was the head of ENT at Lenox Hill and Manhattan Eye, Ear, and Throat. he used to ask Dr. Lisa and Danielle, please do Thermage on this patient to make more collagen before I did the facelift. Even he recognized the genius of making more collagen, even though he was doing facelifts. By the way, he's terrific if you do want a facelift. Now I think I'm done. I think I nailed everything. So sorry for this long one, and sorry for speaking quickly. You can go back and listen to it again, but I kind of I hate to drag things out. I mean, I know when you're on YouTube, everyone's doing these 1-hour YouTubes, and I'm like, you guys suck. All you're trying to do is make money. If you can impart the information quickly, just do it. And in case, okay, so I'll drag this out a little bit, not because I want to drag it out. You got it all. You can turn it off right now, but just to recap. So, lasers for getting rid of little blemishes, radio frequency, Thermage. Actually, there's other devices as well, Ultra Shape, Vela Shape, whatever. The thing is, you want someone that's done 20,000 treatments, because with radio frequency, you need to go up to 45, 46 degrees before you actually hit the collagen hard enough to stimulate new collagen growth and tighten the collagen. So you want the most experienced person. And the other thing that's a joke, I guess I'm still talking. The other thing that's a joke is Cutera. Sorry, Cutera. Guess you're never going to sponsor me. They put little pads and say, oh, we got radio frequency. Well, you know what? You don't have to be a doctor to figure this out. If you're putting little pads in one spot, you can't go past 42 degrees because you'll burn somebody. When you're holding a wand, you can go up to 44, 45, 46. We even give people painkillers so we can go to the highest possible temperature so they can get an effective treatment. Oh God, I'm still talking, but that's okay. If you're still listening, I'm still talking. So anyway, Danielle calls me up once and says, hey, you know that nice lady you spoke to? She came in to do a Thermage. She refused to take a painkiller, and I'm calling you up to let you know, because you're the one who spoke to her. I'm so afraid she's not going to get a good result, because every time I went to the temperature I know would give her a great result. She was screaming bloody murder, so I had to keep the temperature really low, and I doubt she's going to get a very good result, which, by the way, is very interesting because BTL is rebranding Exilis with the temperature throttled down to 42. I'm like, oh my God, I wish people understood what's going on here. They're literally making the machine so that all the stupid med spas can use it with their 12-year-old, people running the machines that have no idea what they're doing, so they don't burn anybody. Well, you know what? I'm sorry. You have to go to a high temperature to get a good result. And by the way, that's why you don't see devices like Emtone and Thermage and Exilis at these med spas, because they don't want it. The risk-reward ratio is nothing. As long as they can charge a fortune, give you a light treatment, they're making money. Why would they take the risk? I mean, we've never burned anyone, not even given them a sunburn once in 20,000 treatments over 17 years. But you have to be experienced to do that. So you have all these radio frequency devices that, again, you have to know what temperature to go at to get an effective treatment, but you got to walk the line. Here, I'll give you one more story. So I'm actually at the Cutera seminar, and the guy is, and that's the one where they put a bunch of little pads, and with the radio frequency. So I know the answer, and you know the answer now too. When you have a wand and you can get to the highest possible temperature, and then when you get to that absolute ridiculously high temperature, you move to the next area, which of course you can't do that with a pad stuck in one spot. So I said, how would you compare the Cutera with all these little pads, and they were using it on the body, to a handheld, technology? He goes, oh, I don't know. I've never used one. I'm like, in my mind, I didn't say the words, and so why are you lecturing when I know 1,000 times more than you do? And that's pathetic. And you actually know 1,000 times more than the doctor that was lecturing, just from the little bit I've explained to you. Again, it's not that complicated. If your pad is stuck in one spot, you can only go to a certain temperature, and it's not even the effective temperature. When someone's holding a wand who really knows what they're doing, they can go to the highest possible temperature. Now, I'll give you one more story, which I probably shouldn't, but what the hell, that's who I am. So one time I get to the office, and Danielle said, you need a Percocet. I said, oh, I already took 2. She goes, you took 2? What, are you kidding me? I said, well, how do I, I think I told her I volunteered that I took 2 Percocets. I said, well, how do I know you're not going to burn me? She goes, I can't believe you are asking me that question. And she goes, I don't care if you're screaming bloody murder or not. She goes, I know the temperature I'm at. And when I get to the highest possible effective temperature, I move to the next area, because they can read the temperature of your skin while they're treating you. So it actually has to be a really, 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 really talented person that can, look at your face. One side is a little bit different than the other. Actually, I'm getting evened out pretty good, believe it or not. I used to be really lopsided. And so they can maybe you have a little extra skin under your chin, so you might want to save an extra 50 pulses there. Some people actually, they're so thin here, they could use cheek implants. So you might want to go gingerly here, not too many pulses there. So it's kind of funny, by the way. One lady asked me, do you use the grid? So day one, maybe 20 years ago, they said you put a grid on the face. So you 200 pulses here, 200 pulses here, 200 pulses here. Well, you would never do that if you looked at someone's face and realized that, they can't handle it. They need a lot more here. They have a lot of loose skin and fat. So you might want to, save an extra 100 pulses or more over here. You might only want to do 50 here, just a little bit of lift. But again, not too much. You don't want to melt what little they have in their cheeks. So you have to be looking at all that, considering how you're treating. Watch the temperature. It's not easy. And again, I'm segueing off that day with her, and she's like, don't worry about it. I got you covered. So you need the most experienced practitioner and practical advice. So you don't want to just know how many years they've been in business. Yeah, we've been around 17 years, but what if we just got someone new and started training them next week, and you walk in, do you want the person that you're their first person they treated? So it's not about how many years the place has been around, it's how many years the person treating you, how much experience do they have? So that's like one of the most important questions. The other thing about Thermage, by the way, since I mentioned it, they have so many different tips. They have 200 pulse tips, they have 600 pulse tips, they have 900 pulse tips, they have 1200 pulse tips. That's actually a body tip normally, the 1200 pulse tip. We use the 1200 pulse tip on the face so we can do the full face and the neck. Yeah, if someone's doing 600 pulses on your face, that's a half a treatment. So you can't even compare the price of a 600 pulse treatment to a 1200 pulse treatment. That's like comparing a 6-pack to a 12-pack, okay? Not that complicated, people. You want to know how many pulses you're getting. And the price, let me tell you something. The retail price of one tip, 1200 pulse tip, I think it's like $900. So these places that are advertising $1,500 for Thermage, it's like, I guess they're doing it on the street. They're not paying rent. They don't have a doctor. And then the other possibility, by the way, is I get emails all the time. Like, we sell you Thermage tips from China for $25. Like, are you kidding me? Not in a million years. The tip is a one and done. It actually looks a little bit like your ink cartridge. It's got a little foil thing on top of it where the energy passes through, and it's measured in thousandths of a millimeter. So if it's not the absolute drop dead perfect thickness, you're going to get too much energy burned, or too little energy, not an effective treatment. Now, those particular things can be, and the machine is calibrated perfectly together. Actually, we had once in the past 20 years, I don't even know why, but someone questioned whether they had an effective treatment or something. So we sent it back to Thermage. They could give a readout on every single pulse of 1200 pulses and what temperature it was delivered at. Not going to happen with a bootleg tip at $25, and maybe that's why they're delivering their treatment for $1,500. That's a joke. It's even 20 years ago, 15 years ago, I asked the Thermage rep, I said, how much do you pay a good technician? He said $100,000 a year. So, you're paying someone a lot of money that has a lot of experience to deliver a fabulous treatment. And by the way, as a patient, it doesn't matter what you pay if you're not getting a good treatment. It's like, so you're going to pay half price and get a shitty treatment and not get any results, or do you want to just pay twice as much and get a phenomenal treatment and get phenomenal results? I remember my first treatment in 2007 to this day. It was so weird. I remember, honestly, I didn't see that much right away. But 3 to 6 months later, I'm shaving and I'm like, oh my God, my skin is so tight, because men, we pull on our skin as we shave. I don't even have to do that anymore. My skin is so taut. Yeah, that's funny. I didn't even think about that. I used to do like everybody else. You pull on your skin while you shave. I don't even do that anymore. My skin is so firm. I should have led with that. And by the way, I just turned 70. Hate to say it because it sounds so disgusting. What a ridiculous age, but I'm gonna continue to de-age and get younger, and hopefully I'll be 30 in another 10 years. Wow. Yeah. Huh. And I do have my pictures in the blog as well. And you can see what I look like in my 30s, and you can see all the loose skin. Very interesting. And as soon as I'm done, I'm going to showcase my abs as well, because I gain a little bit of weight during the pandemic, and I haven't lost it yet. I mean, I still have my abs, but a little bit of fat covering it, and I'm not doing Exilis. I'm not that narcissistic. I should be able to lose the weight myself, just do a little Emsculpt and be done with it. Anyway, that's me. What else? Oh, I actually started using the C serum. It actually feels really good. And we'll get the vitamins and the skincare all put together for you guys as well. But we believe very strongly we want to do the right thing, not just sell crap. As a matter of fact, Dr. Lee's always pissed me off because she would buy one thing from each of 10 manufacturers, so I could never get a discount. But you know what? It's all about integrity and offering the best products that we absolutely can offer, regardless of the margins or the volume or the discounts. And that's who you want to deal with. And I hope and pray that at the end of the day, doing the right thing will win the day. Not to make us rich, but to keep us around so we can continue delivering the best possible services on the planet. That's our goal. Thank you very much for listening this long. If you listen this long, and send me your comments. Thanks. Bye.